The South Shore's Morning News rolls on. Thank you so much for starting your morning with us. I'm Rob Hackala. Beth Foster is off. She'll be back with us tomorrow. We have intern Paul helping out the broadcast today. Paul, good morning to you.
Good morning. Good morning, everybody.
Great to have you over there, Paul, helping out with the broadcast. And as promised in this segment, we're excited to bring on our next guest. Dr. Walter Stanwood is with us now. Dr. Stanwood is part of the great team at Plymouth Bay Orthopedic Associates, pbortho.com. Dr. Walter Stanwood has been practicing shoulder, elbow, and sports medicine for many years now at Plymouth Bay Orthopedic Associates. He joins us now. We're going to talk about shoulder pain in the weekend warrior. Dr. Stanwood, good morning.
Good morning. Thank you so much for having me.
Yeah, absolutely. Great to have you on here. So tell us a little bit about when you mentioned shoulder pain in the weekend warrior. What are some of the big things that you see typically on a day-to-day basis?
Yeah, absolutely. A common thing I see in, anyone I say, over the age of 35 to 40 can start to get these things spontaneously. And oftentimes they say, yes, what have I done to create this, or what haven't I done? And oftentimes it's nothing that isn't internally wrong with you, or that you've done something erroneous. It's just that as we age, our bodies need a little more TLC, I like to say, and that what that comes in the form of. Oftentimes, I tell patients that the warm up before an activity is great preventative medicine. And that can, help stretch the muscles, helps, get the blood flow to the area. A big one that we see that's picked up in the area, and everyone's aware of pickleball nowadays. And, those injuries we've seen a big influx in. And, they'll come in and say, gosh, I'm trying to be active. Why is this hurting so much? And I think, again, the stretching is a big thing, and specific exercises for your rotator cuff is probably the most important thing you can do. And we've got, a link to that on our website that gives you, a nice list that's printed by our academy that can help you in that regard.
Wow. Okay. So that's important. Again, warming up, and maybe, because you mentioned the above certain age category, and I'm in that. And yeah, it's just easy to go out and just start the activity, whatever it is. It can be sports, but it could be, a project or stuff around the house, right?
Absolutely. And that's the thing. You don't recognize these, what you would see are seemingly innocuous activities when you're 20. It's not the same when you're 40. And, going out to rake the lawn or pick up sticks even, a quick 5-minute warm-up is a good kind of preventative medicine, if you will.
Doctor, what are the impacts? Say you do have the shoulder pain, and if you don't do any treatment at all, is this the kind of case where something can get worse down the line and get even more damaged?
Yeah. So if that happens, and let's say even if you do the preventative things, and you're getting persistent pain around the shoulder, the first thing I'd like to say, because I think a lot of people have a feeling out there that, gosh, it's arthritis. My friend has knee arthritis. They get knee pain when they start to do activities. And I will tell you, in the shoulder, that's very uncommon. The most common, the overreaching issue around the shoulder is rotator cuff. And so if you start to develop these rotator cuff symptoms, despite the stretching and the exercises we talk about, the next step there, again, stuff that you can still do on your own, is something like we call them NSAIDs, non-steroidal anti-inflammatories. So that's the ibuprofens, the Aleve of the world that are out there. If you can, they do have some issues, gastric upset in some people. But if you're able to take those you can take around or before at work or exercises. And then even that have evolved more in the last 5 to 7 years, I'd say, are topicals. Things like there's over-the-counter NSAIDs that you can get that are in the cream form. You can get, there's lots of even herbal things that people swear by in my office that can provide relief.
Wow. What about in terms of, any talking about, because some people will use ice or heat is one of those.
Sure.
No, what can you tell? Because sometimes people will try to treat themselves. Is there anything to tell people?
That's a great question. I get that a lot. Is it ice doc? Is it heat? Which one? And I'll tell you, the data says for these kind of chronic intermittent overuse injuries, there's no data that says one's better than the other. Oh. I would tell you in general terms.
Yeah.
If you're gonna follow something, I would say heat before an activity and ice after.
Okay, there you go. Remember that, heat before, ice after. And then what is the recovery time? Say you like to do the pickleball, you get injured. How you would tell people how long is it before they could resume their activity?
Yeah, when I see someone, by the time they've come in, they've probably aggravated it for a good 4 to 6 weeks, and I usually tell them it's going to need that same amount of time to kind of download, and if you will, or let that inflammation and swelling kind of resolve. And during that same time period, you need to take those NSAIDs, if you can take those ibuprofens, and do those exercises on a very regular basis to help facilitate that recovery.
Mm. All right, so if people want to reach out to you, Dr. Walter Stanwood and the great team, Plymouth Bay Orthopedic, you mentioned there's great stuff on the website, pbortho.com. The offices are located where, Dr. Stanwood?
Yes, we've got our main office, if you will, is in Plymouth at 41 Resnick Road, and we have within that there we have a great pain clinic that for other issues that, again, if we go back to pickleball and spine injuries and back pain, we've got that all located in there. We've also got physical therapy in that office, and soon to be, if you come by our office, you'll see we've got construction of an ambulatory surgery center that will hopefully be open the end of the year. And then we've got a satellite office in Duxbury, and we also have one in Sandwich, just over the bridge.
Great stuff. Dr. Walter Stanwood has been with us today. And Dr. Stanwood, we have one text that came in that we'll read. This seems like a good way to end it. It's a great comment from Joanne from Randolph that she wanted to share with the audience. She just wanted to share she had a great experience with Plymouth Bay Orthopedics. I'll read this. This just came in. It was back when COVID restrictions were first released and we could go back to office visits. I was very active, but suffering sciatica bursitis, chronic sciatica bursitis, and also had back pain. I didn't know where to start. I talked to the great team over there. It was one of the best decisions I ever made. He got me into the spine center where I saw a wonderful chiropractor, physical therapist. What a great combination, and it paid off. So thank you, Plymouth Bay Orthopedic. That's from Joanne from Randolph. So thank you, Joanne. Good story.
All right.
And Dr. Stanwood, thank you so much for coming on.
I appreciate you having me.
Absolutely. That's Dr. Walter Stanwood, Plymouth Bay Orthopedic. And again, get the details, pbortho.com.